Hello, everyone. My name is Amanda Ruback, and I'm a nurse and the Community Outreach Coordinator at the Missouri Poison Center. And I thought today we'd talk a little bit about poison prevention, especially when it comes to COVID and some of the circumstances and the things we're seeing at poison centers. So today I hope to just give you a little overview of who the Missouri Poison Center is, and then talk about a couple of topics that are COVID specific, specifically cleaners and disinfectants, hand sanitizers, and additional medications. And so poison centers really started back a long time ago. We were first a department in the emergency department at Cardinal Glennon Children's Hospital. We still remain tied to them, but we also now cover the entire state of Missouri as an outreach, as a center where people can call across the state, young, old, something in between, and we're all here pictured, some nurses and pharmacists, which is who you'll speak to when you call the Poison Center. We're also backed by our board-certified medical toxicologist who's available 24 hours a day for additional consultation on our behalf. And we have our managing director who's been a pharmacist at the Poison Center for quite a number of years. So we're all there to help serve you. And so when you look at the map here, you see that Missouri has one single poison center, and we're in St. Louis area, as I mentioned, and all the other triangles and dots represent other poison centers, the other 55 poison centers in total across the country. And so all states are really covered by at least one poison center. As I mentioned, here in Missouri, in St. Louis, we're not necessarily geographically centrally located, but we do cover the entire state, all four corners and everything in between, on our 1-800-222-1222 number. That's a national number. So whatever phone you're calling from, it'll route you to the state that you need. Sort of like how 911 does, it gets you to the right place. This will happen as well. If you're calling from a Missouri phone, you'll get the Missouri Poison Center. And so Missouri really, as I mentioned, we have the 18th largest of the all 50 states in terms of population. So we have a fair number of people in the state, but we do see pretty big divide in terms of the two cities being Kansas City and St. Louis area having more than half of the population of the whole state. But we do take calls from everywhere. As you can see, there's a map showing the number of calls we get based on county. And since our first year operation in 1974, we've handled over 1.7 million cases or calls. So we've been around a long time, and we have helped Missourians throughout that time. And so here's an example of kind of our call center. As I mentioned, we're all registered nurses and pharmacists who are additionally specialists in poison information. You can reach the Missouri Poison Center. We also have access to a translation interpreter line that we can speak in 150 languages through, and also through Missouri Relay Services for the hearing impaired. So no matter if there's any barriers, feel free to reach out to us and we'll be able to help you in the best way we can. So if you look at kind of total number of calls or cases that we've had in 2019, we've had over 55,000 exposures, meaning something happened to somebody, whether it was somebody swallowed something, somebody got something on their skin or in their eyes. Then we also get about 5,000 information calls, and these are more of a question or a curiosity. So nothing has actually happened. We're not seeing an exposure, but person might call and ask if they can take like a medicine A with medicine B, or if they can take a certain medication while they're pregnant, or if there's interactions between two things. So those are great ways, or great reasons, excuse me, to call the Poison Center. And all that totals up to just over 60,000 calls in the last year. The majority of those calls do come in from people like you, the general public, so via the phone line, via text or web chat, which is available off our website. And then about 28% come in from healthcare providers, whether that's a physician or nurse in the emergency room, a pharmacist, even dentists have questions regarding medications or exposures. Many times it's from EMS workers or EMTs who are in the field caring for somebody, and occasionally police and other healthcare services type people. So we get calls from lots of different groups. And so when we think about a poison, you know, our definition really is that a poison is any product or substance that can harm someone if it's used in the wrong way or the wrong amount or by the wrong person. So you can kind of see on that list a number of different things, both medications and chemicals, drugs of abuse, as well as things that might just be in your home for regular everyday use. We get a lot of different types of calls, and really anything you can think of could potentially become a poison if it was used in the wrong way or the wrong amount. And so this is kind of just a very small example of all the different types of things we might get calls on a day-to-day basis. And of course, we get calls on different things as well. So routes. So a lot of times you just think about somebody swallowing something. My child ate this, or I accidentally drank that. But we do get calls for eye exposures, as well as skin exposures. A lot of that might be through a chemical spill or a pesticide use in the springtime. We also get inhalation or breathing inhalation type of exposures. And some things we can think about there are carbon monoxide or fumes from chemicals. And then what's not listed is sort of the other, right? So we occasionally get some snake bites, some envenomation with spiders or bees or other things in nature. So we can take calls on lots of different types of routes. And so let's start looking at kind of what's going on with COVID and poisonings these days. And so here are some of the reasons why we are seeing an increase in poisonings surrounded in the last month or two. We're all really home. And we know that is true because we've been home many, many weeks now. And the majority of poisonings do happen in the home as compared to other places. Our kids are home. We have increased use and access of products. So we're using our cleaners more. We're using our hand sanitizer more. And so these products are available and in use. And then we have parents working, schooling from home. So there's maybe this increased stress and distraction. And then we also have this change in routine, right? So we're taking our medications maybe at different times because we're staying up to do things at different times. So our lifestyle kind of has changed. And then of course, there's always rumors and misinformation surrounding COVID and health scares. And so that can play into this as well, why we see more poisonings at this time. And so when we talk specifically about cleaners and disinfectants, we really know that this has always been a common call for poison centers, right? Kids get into the bleach, kids spray the spray bottle, adults using the product and maybe using it in the wrong way. And so now that we're in our homes, using them regularly, more frequently, we're seeing more calls. But we also have sort of this mishandling, right? So we're being very diligent about continuously cleaning and maybe not wearing gloves or washing our hands appropriately afterwards. And then often with that distraction, we may not store it or put it away properly, especially if we're busy doing something. We may leave it out for another use, such as a cleaner or a disinfectant wipe. And then maybe we'll walk away from it and our children or pets or somebody might accidentally get into it. And so when we kind of look at the difference between cleaning products and sanitation products and disinfecting products, I think this is kind of a good chart to see what the difference is. So we know that when we clean, let's say with just soap and water type of thing, we remove dirt and impurities from the surface. We can really use it on a lot of different surfaces. You might remove some of the germs, but you're not going to kill them, right? So when you sanitize, that's kind of the next step up. So we get that lower germ count. We can use it on a lot of household surfaces. This also could be used on food contact surfaces. So this is kind of what we're seeing with our dishes, right? We're washing and going through that sanitizing process through that. That is effective against some bacteria, of course, not all. And this is really good, like I said, for these contact surfaces that you're gonna have in contact with your eating or drinking. really the best home method is disinfection, right? And so these germs are mostly killed, right? Including bacteria and fungi and certain viruses, which is what we're most concerned about now. So this is for household surfaces. It is not for food contact surfaces. So an example of this that we have been hearing more about recently is the use of disinfectant wipes on groceries, like on produce or on certain items coming home from the grocery store. And so that's not an appropriate use of that item because it really is a food contact surface, and we're running the risk of of that being transferred to us. And so when we think about disinfecting, we really need to work on cleaning first. So we actually need to get that dirt and stuff off first before the disinfecting is appropriate. And then there's also certain rules around the time that it has to be in contact with the disinfectant or the type of solution. And so it's really best to read those labels very clearly, follow the ratios of how to dilute something when we think about bleach or something. And then also make sure it's in contact with that disinfectant solution for the appropriate time for it to work. And so bleach really has become, of course, something we are seeing lots of calls about. I know this is kind of a busy chart, but what we're really seeing is this 48% increase from this time last year to this time in 2020. So 48% increase in bleach calls. So some of that is due to that ratio, not mixing properly. Some of that is also potentially due to mixing it with something else, right? And so what we can see there is sort of this gas or this chlorine gas that can be produced if we mix it with something acidic or something like an ammonia. So we really say for bleach that bleach is a friend to nobody except water. It should never be mixed. That includes bleach that is in cleaners. So sometimes it's a hidden thing in some of the cleaners that we're using. So like the word sodium hypochlorite is another term for bleach, and you might see that in some of the sprays, the multi-purpose sprays. So it's really best just to keep chemicals on their own or diluted in the appropriate way. And then additionally, when we're cleaning, opening windows, ventilation, we encourage the use of gloves if possible, and certainly washing our hands very well after use. Again, following the label directions, not to use things on body surfaces that are disinfectants or on food surfaces. And then when we look at things, we talk about signal words. And so these are kind of different, right? And so you might see the word caution. And so that's what would be considered the lowest risk. It's minimally toxic. We don't see any lingering effects. A word like warning on a label is considered moderately toxic, so it could cause some additional concerns. And then the word danger is really highly toxic and something that could cause permanent damage. So if we see words like caution, warning, and danger, it's a progression of risk that we can see. And that's something we can help you decipher if you have questions about on the hotline as well. Oh, here's a good picture of the cleaning things do not mix, right? So we have things like bleach and vinegar don't mix, bleach and ammonia, certainly bleach and rubbing alcohol, and then also hydrogen peroxide and vinegar. All these things that we like to use that we're kind of even forced now to use because of how we have to go out and find these things, right? A lot of those traditional cleaners are hard to find, so we're making our own. So it's really important to know that bleach is a friend to no one. We only dilute it with water, as I mentioned. And if you have questions, make sure you do the research first. Ask those questions before you mix those chemicals. And then lastly, for storage, in terms of cleaning products, we know there's no such thing as child-proof safe storage. So we really have to be careful and store those cleaning products up high and out of reach, preferably locked. And then not to store things like that near our food items. So often we'll have cleaning products in our kitchens. We need to make sure they're located in different areas with the additional locking device. And then not transferring things into unmarked bottles. Sometimes we'll see people put them into buckets or water bottles to dilute it down with some water. And then an unsuspecting child or a spouse will come by and drink that bottle and accidentally swallowing it. We also see there on the picture that a lot of our cleaning products and household products are lookalikes, right? So you're seeing the Gatorade, the sports drinks there with the cleaning product, and then the rubbing alcohol and just traditional water. So really for young children, we see that there's a lot of things that are lookalike. So we encourage you to kind of think that through. We have a great game on our website, on our Kids Zone, to look at lookalikes with your kids. So feel free to go there and to play that online game as well. And so when we look at the next kind of topic, it's hand sanitizer, which we're all using a lot more of, and we're all trying to find a lot more of in the stores. And we know that as with bleach, we have seen an increase in hand sanitizer calls by 32%. And of course, those little ones, those 0 to 5-year-olds, are our biggest culprits. The problem with hand sanitizer is that it has a lot of alcohol in it, right? And so it's almost it's really more than a traditional beer or wine, even more than a shot. Many have 70% alcohol or higher. Now, a lick or a taste off a hand is not going to be enough to cause a poisoning in a child. But if it was sweet smelling or tempting or pretty to look at or colorful, child could drink more than they are supposed to, and then have some effects such as they would with alcohol. And then often we see some poor storage with hand sanitizers with the pump bottles, and we'll look at that. So we definitely want to supervise children when using hand sanitizer. We're wanting just to use that dime-sized amount, rub it in until it's dry, have them do it in front of you, and have that bottle put away with every use. I know with us using it constantly, it's easier to be left out, but it is still a poison and something we really need to be careful. We also see some eye exposures with hand sanitizer, whether it's from that pump kind of spraying back or splashing up into the face or rubbing to the eyes. We do see some of that. And then, of course, we recommend with anything to put bottles up high and out of reach of children. And then those little personal bottles, you know, those little clip-on things for book bags or backpacks or diaper bags, we want to really be cautious with those use. They're great to have around, to have on hand, but just like that one on the screen there, you can see that it's got a cartoon character. I bet it smells really great. And so with young children, that can be an extra temptation. And so let's move on a little bit here to medicine. And so when we talk about medicine in general, we know that when there's a change in routine, we have the risk of having more medicine mistakes, right? So when you're not going to bed at the same time every night, or you're waking up later, or you're doing things out of your normal, there is that added risk of a mistake. And then we additionally are seeing more people taking different new medications, more supplements, more remedies, and other types of products. So more medications mean more mistakes potentially. And as with anything, as we've talked about, that added stress and distraction is a concern. And then sometimes we see this poor communication, right, between parents. Maybe there's two parents and one was supposed to give one child the medication, but they gave it to the wrong child or the wrong time, or it was double dosed. And so that kind of miscommunication can certainly happen during this time. When we talk about medicine, we also always talk about safe storage. And so we ideally recommend keeping it in an original container, such as the pill bottle or container that it came in. People do like to use those pill planners, those pill boxes, but they're very easily to pop open with young children. And so if you do have any children or visitors in the home, we really encourage them at that time to be put up high, out of reach, and locked away, as well as just kind of done as a courtesy on a regular basis. And then if there are different people in the home, additionally taking different types of medicine, it's really important to kind of keep those separate, right? So we do see a lot of times that spouses will take the other spouse's medicine, or the wrong child will be given a medicine because all the pill bottles kind of look the same. And it's easy just to grab and to not really think it through and to dose in the wrong way. And then we also encourage that if things need to be kept cold and in a fridge, that it really should be separate from food items. Those colorful antibiotic liquids and other things are awful tempting to children when they want to grab some juice or something out of the fridge. And so we also always encourage, whether you're on 1 or 10 different types of medicine, to keep a really nice medicine list. That can be done in lots of different ways. We certainly have paper copies like this. There's all sorts of different things that you can print off and type up, handwrite, other sorts of things. There's apps on the phone. So really use a medicine list, keep track of it, keep it up to date. So whenever you have a dosing change or a medicine discontinuation, you want to make sure to kind of update it. And then we always encourage people, especially older adults who may be on more medicines, to keep a copy with them in their wallet or purse. It's really a safety addition, just in case there were the need for some medical treatment. The medication list is really important. And so also when we talk about medicine, we also know that labels are important too. And we all know this, right? We all know we should read the label, but it does give us lots of information. We'll see uses and these warnings, of course, the directions and timing of doses. And then we can also really see with active ingredients, that biggest section at the top. One of the most common things we see with pain relievers and things that contain acetaminophen, or Tylenol is the other word, is a double dosing. So maybe somebody will be taking a pain medication for arthritis, but then they'll additionally have cold symptoms and they'll take a multi-symptom cold medicine, which has the same acetaminophen or Tylenol in it. And so they're really getting 2 different doses of the same ingredient. So if it is something you're not familiar with, definitely these are great questions to call the Poison Center about before you take the dose, or if you've realized you've done it, we certainly can help you through that. And don't hesitate to call. And then just back to medicine with kids, we really want to model some really good behavior with kids. And so part of that is not to take medicine in front of young children. They imitate adults, they like to do what they do, and we can see that in the case with medicine. Another important tip is not to call medicine candy, right? And so sometimes it's hard to get our kids to take that medicine, to swallow that liquid or the pill. And so we just do whatever we can to get them to do it. But medicine really should be talked about as medicine. And then we really, with dosing, or measuring, whatever came with the bottle, so let's say an over-the-counter pain reliever, they usually come with a syringe or a dosing dispensing cup. And so that really is the best device to use with measuring. We don't encourage use of household spoons or kitchen equipment. Really use the cup it came with. And if you don't have one, you can ask a pharmacist, specifically if you fill a prescription for their assistance. And then we always encourage and talk to kids about not touching it or tasting anything that they find on their own, to kind of come to you. And we have lots of neat little games and activities in our kids zone and our parent section of our website. So feel free to go to that. It's www.missouripoisoncenter.org. All right, and so wouldn't be remiss if I didn't talk a little bit about COVID remedies and treatments in terms of medications. And we certainly are getting our fair share of calls regarding these types of things. But we know there are currently no FDA-approved medications, vaccines, supplements, vitamins, or other remedies for COVID-19 that are FDA regulated at this time. And we also really encourage that anytime you want to start a treatment or start something, it really should be monitored and discussed with your healthcare provider. We can give you our information, but it really is best to go through your doctor to get that additional advice based on your specific situation. And so we've been writing some new posts on both our social media and on our website. And here are a little sampling of them. So we have a great new post about supplements and COVID. We also have something on ivermectin, which is a treatment for dogs, and something we've been seeing in the media about people potentially wanting to take as a remedy. And then our the prescription medications, chloroquine and hydroxychloroquine, the antimalarials that you might have been hearing about in the media. So good, solid information. Also on our website and through our social media, you can call as additionally with questions. So I just want to reiterate that the Poison Center is there for you. We're on 24 hours a day, 7 days a week, 365 days a year. We don't take a break even during this crisis. So we really encourage you to call and ask those questions. You're getting free, fast, confidential help from a registered nurse or a pharmacist. And so you're not just going to the internet or searching for an answer, hoping you might get something that makes sense. You're getting very concrete, accurate information, which hopefully will save you money, because the majority of poisonings, whether it's medication or chemicals, to the most point, certainly with children, we find that many people can stay at home, not going to the emergency room, not tying up the urgent cares. So avoiding that unnecessary treatment, especially during these times when we kind of need to stay in our homes and keep us safe out of harm's way. So feel free to call. Like I said, we're here for you. And just another mention, here's our website. As I mentioned earlier, we have some social media pages, Facebook, Instagram, and Twitter. We have lots of great information daily on those, and feel free to follow us and like us on those platforms. And then I always do this for all our presentations. It's really important. And I would encourage you now just to grab your phone, take it out, save the Missouri Poison Center as a contact in your cell phone. So we have magnets, we have great little reminders that you can order, but the best thing is just to have it there in your phone, because during a moment of concern or panic where you're worried about your children or a loved one, we often forget the number. We can't figure out where to get it. And so it's really important just to throw that number in your cell phone now, save it. You never know when you need it. And like I said, you can use us 24 hours a day with exposures or questions alike. And so I hope you've enjoyed our presentation. We hope to do more of these. Feel free to reach out to us if you have additional questions or would like additional materials. Go to our website, reach out to me via email, and I wish you well and a safe and healthy spring.